They did the study on, OIG did this study first on facet joint injections, then on transforaminals. 63% of them in 2006 did not meet program requirements. They had $129 million in improper payments. With the transforaminal injections, 19% had a documentation error and $23 million in improper payments. They looked at the number of mistakes or documentation errors. All of them have pretty high, like neurosurgery, no problem, no issue. If you don't know what you're doing, it is pretty easy. My neurosurgeon, he's a retired neurosurgeon. Now he decided to get into pain management in Paducah. He keeps saying, Lax, you know I can do anything, everything. And this neurosurgeon I was talking about was using a spinal needle to do the epidural. You do that in the cervical spine and you can get into some serious trouble. 100% documentation errors. A lot of people go into this class of 100%. They are the best people. And only good news is that we are doing much better. Interventional pain management, only 12% errors. So we are the lowest ones. We are doing much better than others. So how much is $1 trillion? We are talking about deficits. I think, are we shutting down the government today? I certainly hope so. I really want government to be shut down for 6 months, so we won't have any of these stupid regulations. Nothing. So Ronald Reagan said 1 million seconds equal 12 days, 1 trillion seconds is more than 30,000 years. Now we are looking at $1.4 trillion deficit per year. And our just Medicare obligations are $13 trillion in next 30 years. $13 trillion. Social Security obligations are $32 trillion. So calculate with 30,000 years times 13, that will give you how much money it is. The White House projected that there will be $9 trillion in the next 10 years when Obama took over, but that is going to be more like $40 trillion now. So the Social Security was 43 trillion there originally, but it is up to 60 trillion now. So $1 trillion would be a stack of 1,000 bills 67 miles high. So this is our Obamacare. Did we want a reform? Yes. Did we want this reform? No. Most people think their coverage is good. This was old study, but a lot of people are now changing their mind because private insurers are giving them a lot of trouble. 32 million are supposed to get more health coverage under the new plan, but that is not going to happen. There are lots of regulations. Now, more people are not going to be covered, but this is happening. Strict federal regulations and mandates. New taxes and penalties, that is coming, or it is already there. And cuts in Medicare. So we are cutting Medicare. This is all creative economics. Cuts and savings in Medicare, they come $220 billion from physician payment cuts. So they are using that as a saving. That translates into $440 billion. They are using cuts from Medicare Advantage plans. So we don't have any money in Medicare, so we are saving what we don't have, and we are spending it on something else. That really works, right, if you run a business? So healthcare is not going to be universal. It said 92% covered, 8% not covered, but that is not going to happen. So this is how this goes on. So what I was telling you before was Medicaid was less than Medicare, right? No longer. In 2009, Medicaid became more than Medicaid by $4 billion, 4 billion million people covered. It is going to be much, much higher pretty soon. State budgets are having a lot of problems. You think California is pretty bad. If you just look at in millions of dollars, it is close to 12 million. You think it is pretty bad. What? Well, just Medicaid spending I'm talking about. This is 12 billion they are spending on Medicaid in California. That is 13% of the total expenditures. Look at Ohio. 38% of their budget. Look at Massachusetts, 30%. So we are there. The costs are still going to increase with Obamacare. If that is implemented, there may be slight difference. Now, overall health care as percentage of GDP is not going to decrease. It is going to increase. But some of the issues are going to reduce. So, this is the Fresh Medicine, a book written by Philip Bredesen. He was a two-term, very popular governor of Tennessee and a strong supporter of Obama, no longer. He wrote this book. He gives a major plan how to save the money and don't have to follow Obamacare. So everybody is going to change and go into these exchanges, and they don't have to pay. In a hypothetical situation, I pay $16,000 per family now. By 2014, I will be paying probably $18,000. But I can get out of that by paying $2,200 fine for each employee. So am I going to stay and pay 16 or 22? It is very simple. It can push many, many people out of the employer-sponsored program. And it is going to happen is less coverage, higher premiums, high out-of-pocket expenses. So this is, if it is implemented, Obamacare will have, everybody will have insurance. Very few will have coverage. That is it. So this is an article I sat down a few days and wrote a long article. You can read it. It is in Pain Physician. It gives you all the particulars about before, after implications. So are they going to repeal, replace, defund? None of this is going to happen. Courts are saying it is unconstitutional. But is Supreme Court going to rule that it is unconstitutional? We don't know. Then they came up with this 500-page new rule just a day before, and then you get the rule about after a few days. So I received this on May 16th. I didn't read it for 2 weeks after that, but it already went into effect on May 14th. So there are lots of issues. They are spending $50 million just for ASCs, which is like a 2% of healthcare budget, to control infection, healthcare-associated infections. And they are basing on this so-called major evidence-based medicine from an endoscopy clinic who don't clean their stuff properly, and they keep using the same syringes to give propofol. The only one we do have is that they had this synthetic celestone or depomedrol. That is where we got the infections. So because of that, we have to use a single-dose vial, use 5 cc of your Omnipaque or IsoView, whatever, and throw away 45 cc. And we don't know what is going to happen to our green environment, so-called green. We are trying to save the environment, and we are going to throw all this dump radioactive materials. We have new offices and boards. These are the most important ones, which are going to alter entire medicine. I'm not really worried about the entire Obamacare. If these two are gone, I will be happy. They can't do that much more. But these are the most damaging issues. This is what the comparative effectiveness research used to be. Now it is Outcomes Research Institute. This is what they call PCORI, P-C-O-R-I, PCORI. Independent Advisory Board, I think, may be out pretty soon. 100% of the Republicans and 45% of the Democrats are supporting to repeal this. So more than likely it will be repealed. There is a bill in the House and in the Senate. But PCORI is the thing nobody is understanding. The worst thing is, if you were following what was happening in Washington, there is a lady called Holly Curry. She was running the Washington State Health Advisory Institute or Commission. She has been appointed to run this, PCORI. So we have a lot of misconceptions about our specialty itself, increasing healthcare costs, memberships, controlled substance abuse. We should take credit how we increased this controlled substance abuse in the United States. It was all because of our paying doctors supporting the advocacy. I went to this meeting in AAPM meeting. I think they had 2 lectures on other than opioids. One of them was mine on interventional techniques. It's all opioids. You go through how careful you have to be and everything, and then essentially leads to how much more you can give. That's all the solutions. There is going to be an expose on how these regulations came about, how much influence Purdue Pharma has on our guidelines. So in short, this is what it is. When Ronald Reagan was president, we had Bob Hope and Johnny Cash still with us, and they were entertaining. Now we have Obama with no hope and no cash.